Well, we are out here in a certified pandemic, y'all. We are out here in a state of emergency. What does this mean? Well, let me tell you my vantage point and my perspective. I have stayed up late doing as much research as I possibly could. I was on the phone earlier today talking with somebody who is very close to a biotech scientist who spent their career, a 50-year career, working on viruses such as corona and actually on coronavirus. Coronavirus is a type of virus. COVID-19 is a new strand of coronavirus. So corona's been here for a while. This is a new strand. It's ultimately a respiratory virus. So it attacks the respiratory system. So let me just say this to everybody who is in mass hysteria, panicking and freaking out. Calm down. Calm down. Follow protocol. Let's talk about protocol. Sanitary conditions. Be sanitary as possible. Practice social distancing. Limit your time out and about, interacting with other people. But don't freaking panic. God is in control. More on that later. For all my other people on the other end of the spectrum, it's not a big deal. I've had the flu before. Why is everybody panicking? Oh my gosh. Now listen, maybe you can get this flu and this virus and be fine. But now you are at risk of infecting people who won't be fine if they contract it. It'll be critical for them. It could be fatal for them. And so let's be mindful of those individuals. Sure, you may have great respiratory system. You may have no health conditions, but now you're a carrier of this and you are running around arrogantly at risk of infecting someone who, immune system can't handle it. So let's be cautious and kind for those folks as well. Here's my thing. I just want to follow protocol and I want to be sanitary regardless, because I don't want to see what happened in China happen here. What happened in China was the hospitals were flooded, overwhelmed. Workers were stressed out. Same in Italy. Hospitals flooded, workers overwhelmed. And if it's attacking your respiratory system, they're having to decide who gets the oxygen tank and who doesn't. Now, I can just follow protocol and chill, stay sanitary, not need to go to the hospital, and allow the little girl who has some other life-threatening disease to get the care that she needs because I'm not taking up a hospital bed. That to me is just loving, it's kind, it's gracious. Here's my last point on the whole thing. God is in control. We live in a world that is broken. There have been pandemics, there have been wars, there have been bombs, there have been plagues since humanity's been here. It is not an excuse for us to act inhumane and as if God is not in control and as if he's not a God we can trust. He's brought people through it, not without pain and not without suffering, not without loss, but ultimately, this shows me where my true rewards are, where my hope really is, where my faith really is.